Yeah.
In 2015, neurological disorders, classifying stroke as a neurological disorder rather than a cardiovascular disease, ranked as the leading cause group of disability-adjusted life years lost, and the second leading cause group of deaths in the world. It's a growing problem, and the number of deaths attributable to that cause having increased 36.7% and the number of dailies by 7.4% between 1990 and 2015. Afghanistan has among the highest daily rates and highest death rates for neurological diseases in the world. It is estimated that the prevalence of people living with neurological disorders will continue to grow in the coming years, and that means the need for clinicians and facilities that can provide needed treatment, a need that is currently undermet, will continue to grow. We chose to address the problem of neurological disorders in Afghanistan. After years of conflict, the Afghan healthcare system is in disarray and severely underfunded, causing much suffering in this very poor nation with unequally distributed resources. Challenges range from shortages of trained personnel to security issues and lack of funds. The Afghan government has identified mental health services as crucial, but so far has failed to budget adequately to provide them.
So how do neurological diseases affect the Afghan population? First of all, there's not enough education. It seems like everyone in Afghanistan doesn't have the proper resources to be able to take care of these diseases and to learn to deal with them day by day. It would be really great, like a great idea if we could educate families and those people taking care of these members, because they need the education as well so that they can properly take care of their family members. Like I said, we need more resources. We just don't have the amount of resources to be able to help these people and really cure them from this, or to get them the right amount of testing to see what they have so we can diagnose it and treat it correctly. Unfortunately, neurological diseases are actually the major cause of disability for people under the age of 65. So a lot of the time you get diagnosed with this and then you're unable to work and you're unable to take care of your family. A lot of neurological diseases are mistaken for psychological diseases. So unfortunately, a lot of these diseases are going up as missed because a doctor will just prescribe them with like antidepressants and stuff like that, when actually there's a bigger problem at hand. So the epidemiological measurement is mostly contributed to conflict and post-conflict. So a lot of these neurological disorders are being connected to these conflicts that these people are going through in their lives. We need to find a way to address those and to really take care of that problem first. The neurological diseases are a high total burden of disease in Afghanistan and pretty much everywhere. Unfortunately, there's just so many people struggling without the proper resources to get help.
Okay, so the two organizations that are involved with neurological disorders, one of them is the World Federation of Neurology, and their mission statement is, as a UK registered charity, is to foster quality neurology and brain health worldwide. A goal we seek to achieve by promoting global neurological education and training with emphasis placed firmly on under-resourced parts of the world. So their focus is mainly to educate people on neurology and the problem that is at hand. Because we are focused on Afghanistan, they're not necessarily focused on Afghanistan as of yet, but they are worldwide. Another organization that is involved is the American Brain Foundation. Their mission is to bring researchers and donors together to defeat brain disease. The American Brain Foundation is a central driving force behind bringing all neurologists, researchers, patients, and caregivers together to help generate funding for and awareness of brain disease. So they focus more on bringing everyone together. Like they stated in their mission statements, they bring the neurologists, researchers, patients, and caregivers all under one umbrella so that it's easy to tackle the neurological diseases that we have at hand.
Afghan National Security Force provides most of the tertiary care in the country, and about 70% of medical programs are implemented by outside charitable organizations. Non-governmental organizations and charities provide most of the primary care. We plan to partner with NGOs to address the treatment of neurological disorders through the infrastructure that those organizations already have in place, augmenting the equipment and personnel they have on the ground in Afghanistan. The Afghan Institute of Learning builds education and healthcare systems in Afghanistan, and the World Health Organization, most people are pretty familiar with it, fights disease and addresses other health concerns worldwide with education and with health services. We plan to partner with both of those organizations. Transportation is definitely a challenge in Afghanistan. Only about 13% of the 13,000 miles of road in the country are paved, 8% are gravel. Most transportation is either by bus or truck, and men and women, when they're traveling by bus, must travel in separate parts of the buses. So ideally, we will be able to take health care to the people who don't live in large cities. Sturdy vehicles and capable drivers who can provide security and assist with emergency medical treatment will help take care of the people and reduce danger to medical personnel.
So the cost for the vehicle, ideally we'd like to get a strong, sturdy vehicle that will be able to endure the roads in Afghanistan and also keep our patients safe while we're treating them. A 26-inch mobile medical unit, average price is $175,000. I mean, $26. So annual maintenance, this is one thing that you would have to look at just to make it into your cost. An oil change will be needed every 5,000 miles. Drivers will be trained to change oil and perform other minor repairs. We will need to stock 75 quarts of 5W20 oil and oil filters, spark plugs, wiper blades, and other parts. New tires will be needed every 3 years. We will budget about $1,500 a year for parts. Gas is currently 75 cents in Afghanistan, that's US dollars. And a mobile unit will travel an average of 225 miles per week, and it averages 8 miles a gallon on rough terrain. Weekly fuel costs will be about $1,350 a week or $70,200 a year.
We plan to fund our intervention through a combination of grants through USAID and private corporations and through appeals to private organizations. For each mobile unit, we need a physician, preferably a neurologist, or a physician that's been mentored by a neurologist to diagnose and treat neurological disorders, a public health nurse, and a driver, or EMT. Hopefully our drivers will also be trained as EMTs. We plan to have that training be part of our intervention. Doctors will be based in clinics run by our partner organization, the Afghan Institute of Learning, and will have a rotating schedule of traveling in mobile units to reach underserved populations in remote cities and refugee camps. It's difficult to determine a salary schedule for a physician working in Afghanistan because there are significant wage variabilities. Thanks to an influx of foreign money, top business executives may earn as much as $60,000 in American dollars. But when I tried to determine what the average salary for physicians was, it was all over the place. I found salaries ranging from $6,000 to $33,000. The cost of medical school, there are 5 medical schools in Afghanistan, and the cost for the 5 years that it takes to go from high school graduate to doctor is $7,500. And the average wage in Afghanistan for nurses is $11,000. The average wage among Afghan workers in general is $410 a year. All the numbers that I gave are in American dollars. We plan to run our intervention for roughly 5 years and then hand it off to our partner organizations. And during that 5 years, we will get the program up and running. We will fund scholarships for 3 men and 3 women to go to an Afghan medical school. Those scholarships will cost our organization $45,000, but then they will result at the end of that period, the top 2 women and 2 men graduates will be chosen to administer the program, and they will be mentored by our partner physicians, our volunteer physicians that I will talk about in a minute, who will operate the program during the time when they're being trained. And they will then take over the program, and they will work for $25,000 a year, which is actually quite a good wage in Afghanistan. For the program, our program manager will be very important. That's the person who will find the funding and find money to pay for prescriptions as well. That person will earn $20,000 a year. Our nurses will earn $11,000 a year. We will have volunteer nurses for the first 2 years of the intervention, but then years 3 through 5 and beyond, we will need to budget $88,000 to pay for 8 nurses. We'll have 4 drivers, and those drivers will help with security as well as be trained as EMTs to help in medical emergencies, and they'll be paid $2,500 a year. And then we will also train Afghanis to be health educators. These will mostly be women, and they will go throughout the communities and work to screen, to find people who have neurological disorders that have not been diagnosed, and to make sure that those people are diagnosed and treated. Okay, and so just to summarize all that, our annual costs for the first 2 years will be $46,000, and then years 3 to 5, $134,200. When we turn the program over to sustain it with the Afghani trained doctors, it will be $225,200 per year for personnel, for salaries and other personnel costs. We plan to partner with the Church of Jesus Christ of Latter-day Saints, asking them to provide missionaries, 2 retired neurologists, and 2 nurses for a 2-year mission. And then there will be 2 additional 2-year missions where we will ask them to provide 2 retired neurologists each for each period of 2 years. And they will help to get our program off the ground. They will help to train our personnel, and they will also diagnose and treat during the time that they are there. Medication is a very serious cost. Just to give you some examples, to treat Parkinson's disease costs somewhere between $17,000 and $64,000 American dollars a year, depending on the severity and stage that the patient is at. Epilepsy can cost anywhere from $800 to $10,000 a year if it's stable. If they require emergency medical treatment, it can require more than that. Alzheimer's drugs can cost anywhere from $300 to $4,800 annually. These are just examples presented to show you that treatment for neurological disorders is not inexpensive. So the job of our business manager will be to apply for grants and to work with international charities and pharmaceutical companies to ensure that medications will be available to all the patients who need them.
The diagnostic equipment can be very expensive when it comes to neurological tests. So we propose, and what we plan to do is just have our nurses and our doctors run the basic neurological examination. That test and that examination usually consist of motor and sensory skills, different parts of tapping of the body, asking the patient certain questions, also things like asking about current events, what's going on. One the reason why we decided to go with allowing our doctors and our nurses to run these neurological examinations in the vehicles is because the actual equipment, such as x-rays and CT scans and stuff, they're very large and they will not fit into our vehicle. After the nurses and the doctors have done the neurological examination, then they can ask for further tests, which includes the CT scans and all those types of things. If you're interested and if you want to, I put a link down below that just kind of shows your basic neurological examination. After that test is performed, like I said, the doctors and the nurses can go ahead and ask for more testing to be done. And a lot of those testings and facilities are provided by the people who we are partnering with. So just the basic costs for running the neurological the basic test is just going to be the tuning fork set, the diagnostic set, the stethoscope, and the cotton swabs. And those are probably things that are going to be needed by each person, which is in the vehicle, so the nurses and the doctors. So that's just the cost of their equipment that they'll have on hand at all times.
These are our resources. These are all the different things that we used to create our report. We hope you enjoyed it, and hopefully you got a better knowledge of neurological diseases and how we can reach out to third world countries such as Afghanistan.
We did it.
Got
Okay.
it.
I am so glad to have that